HIV or AIDS is a global problem, and there were more than 38 million cases reported in 2020. In Malaysia, 2 out of every 1,000 people are subject to possible HIV infection. The majority of infected persons are men. What is HIV and AIDS? Do you know the difference? HIV, a human immunodeficiency virus, is a virus that weakens the human immune system by killing human body cells that help to fight diseases. There's no cure, but with proper medical care, people with HIV can live long and healthy life. AIDS is caused by HIV, and it stands for Acquired Immune Deficiency Syndrome. HIV destroys the body immune system. When the immune system fails, a patient can develop AIDS and will become chronically ill and die. The virus can be transmitted to anyone. In Malaysia, almost 50% of the new infection is coming from the 20 to 29-year-old age group and the transmission can affect any body regardless of race or ethnicity. Anybody can be at risk of infection of HIV. The main ways to get HIV can be coming from unprotected sex or sex without condom, or with someone who has HIV. The virus can be in our blood and secretions. It can enter through the open wound or cut and lining of the skin. So sharing needles or equipment with a HIV carrier for injecting drugs, tattoos, and piercings can also transmit the virus. One can also be infected during pregnancy and pass on the virus to the baby and through breastfeeding. HIV is not spread by saliva, or through everyday living like sharing meals or drinks, and insect bites or stings and physical contact. Infected individuals can have the virus for up to 10 years, sometimes longer, without showing signs or symptoms. 40 to 90% of newly infected HIV people experience symptoms within 2 to 4 weeks after exposure. Signs and symptoms commonly seen in the early stages of HIV include: the only way to know is by getting tested for HIV at the nearest health clinic. How to protect yourself from being infected? Abstinence by withdrawal from sexual activities. Never sharing needles and drugs equipment. Only having sex with uninfected partner. Protected sex with condom. Get tested. You may be exposed with HIV infection if you have a partner or spouse infected with HIV, you are a sex worker or ever have sex with a sex worker, you or your partner practicing homosexual, you have multiple sexual partners, you have sexual intercourse with your spouse or partner who is a drug addict, you are a drug addict and ever have shared needles. The only way to tell if you have HIV is to take a HIV test. Knowing your own HIV status is the first step to save your life and your loved ones. Testing important because there's treatment. First, go to any government health clinic. See any medical personnel and request for the HIV test. The medical personnel will give advice regarding the test. Your tip of finger will be pricked and 1 drop of blood will be taken for the test. The test result is ready in 15 minutes, using the rapid test kit. If the test result is non-reactive, you will be given further explanation. If you have risk of getting HIV, you will be advised to repeat the test in 6 months. If the test result is reactive, advice will be given and your consent will be taken for the confirmatory test. The test is easily available, simple and painless. This service is provided free of charge at all government health clinics and hospitals. Your personal details and blood test result are kept confidential. HIV test is free. HIV treatment is free. More than 85% of HIV can be suppressed through antiretroviral treatment. Get yourself tested. Get early medical care to save you and your loved ones. Enjoy living a long and healthy life.